Yes, I think there are more outdoor accidents, and actually we see more in the first few months of summer as opposed to the end of summer. And I think people are just really excited to be outside and maybe act a little bit more crazily than they should. So just be careful if you're outside enjoying, the beautiful weather. Usually we'll take down a tourniquet. If EMS has applied one, we'll see how bad the bleeding actually is. A lot of times we can just hold pressure and the bleeding will cease. However, sometimes if it's still ongoing, we'll go to the OR emergently to explore, find whatever's bleeding and stop it that way. Usually with traumatic accidents, we're concerned about bleeding. If people come in and they've lost a lot of blood, we'll usually give 1 liter of fluid and then immediately start going into blood products. So gone are the days of yore where people would get lots of saline. We learn we get better outcomes and patients do better if they immediately receive blood products upon reaching the trauma bay. Massive transfusion protocol is our way of kind of piecing whole blood back together through a combination of packed red blood cells, FFP or fresh frozen plasma, and platelets. For blood products, we try to give O negative for packed red blood cells. If we're lucky enough to know the RH factor, we may give O positive. There are two main instances where I would give platelets kind of without knowing a patient's full medical history. One would be as if we're activating our massive transfusion protocol. The way that works is for every units of red cells, we give 1 unit of plasma and 1 unit of platelets. So if we're going through a multiple cycle, we're giving upwards of 4, 5, 6 units of platelets until we get the bleeding stopped. The other instance that we would give platelets would be if someone's on an antiplatelet drug such as Plavix, which essentially is a suicide inhibitor of platelets. And if you've got a bad head bleed or a solid organ injury, your platelets aren't even functional. So that would be when you would give platelets. I had a patient come in, I can't remember his age, but he was a farmer and he was kicked by one of his horses and his blood pressure was very low. We ended up starting blood immediately. His ultrasound, as I said, was grossly positive for blood products, so we went up to the operating room and his spleen had essentially been smashed into 1,000 pieces. So we ended up taking his entire spleen out. I think he ended up getting 12 or 16 units of red cells and then the appropriate amount of plasma and platelets that go with that. So, 3 or 4 per box of transfusion products. He was extubated the next day and we sent him home 5 days later. So he did very well after surgery, but had we not started early, blood resuscitation, he very well could have died. Don't be afraid to do blood donation. Everyone, sometimes has a fear of needles. They're really not bad. You can't really feel them once they go in. I know because I've donated blood multiple times. It's a nice, controlled, quiet environment. Bring a book or, an iPad or something. Only takes about 45 minutes to an hour. It's a great way to help out your community.